Hey, good evening. I'm Joe Atkins. Welcome to this Dakota County Town Hall meeting on Wednesday, November 18th. It's so nice to see many familiar faces or familiar names. We've got, I asked earlier today for folks to email in some questions. You're also welcome to share questions through the chat feature. Just by clicking on the bottom, click on chat, share your question with everybody, and we'll get to as many questions as we possibly can. We were very fortunate already. We've got more than 70 people that have sent in questions, and so this is obviously going to be a very engaging, very active town hall meeting. With that, I'm going to turn it over. I'm joined tonight by our board chair, Commissioner Mike Slavic, who's going to welcome everybody who joined us this evening. Mike?
Well, thank you and good evening. I just wanted to, as Joe had said, welcome everybody who's been here. It's really exciting for those who've been are coming here to watch via Zoom. We also are on Town Square tonight, as well as on some Facebook Live. So we just want to thank everybody for, we think it's going to be a really good time. We're going to try to keep the information to the beginning and then have a lot more time for questions. So with that, I'm going to pass it back to Commissioner Atkins. Joe?
Thanks, Mike. And next, we're going to go to Christine. Before we do, though, the governor literally just an hour ago announced some new limitations or restrictions guidelines. I believe that we've had an opportunity to throw together a slide that summarizes the governor's new restrictions. And I'll confess, I was bouncing back and forth between Governor Walz and the NBA draft. The Timberwolves, for the first time ever, had the first pick in the first round, and hopefully they didn't mess it up this year. But on a more serious note, we had an opportunity to pick apart the governor's order that he just put out. It was highly leaked over the last couple of days, so I doubt that much of this is going to come as a surprise. But what he did was he put prohibitions on social gatherings, both indoors and outdoors. Any unnecessary travel has been strongly discouraged by Governor Walz on the recommendation of the Minnesota Department of Health. In-person dining has now been prohibited. I believe that takes effect Friday at midnight in restaurants and bars. Takeout, though, is still available, and we obviously all encourage anybody who's has the means to do that. Please support your local restaurants in their takeout business. Gyms, fitness centers, indoor parks, exercise facilities have all been restricted for the coming period. Grocery, retail, salons, though, were not impacted. Just in case you may notice, I got my hair cut today. I wasn't quite sure what the governor was going to say, but I told the nice gal that was cutting my hair, give me one that'll last for at least 4 weeks. So I'm in good shape, I think, haircut wise. Places of worship also are not impacted. And again, this all goes into effect Friday, November 20th, and lasts through Friday, December 18th. So it's a 4-week period that the governor's newest order applies to. And with that, I'm going to turn to our epidemiologist at Dakota County. When you want to talk to somebody about vaccines, when you want to talk about COVID and the latest data, Christine is the person that we turn to. Christine, Bonnie, and others in our department do just a phenomenal job of keeping the board apprised and making sure that we're doing the best that we can at Dakota County. Christine, I'm going to turn it to you to kind of talk about the latest and greatest at Dakota County and what's happening with vaccines and the newest developments that we've seen there.
Sounds good. Hello, everyone. Thanks for joining us tonight. This is really an important topic and also really exciting. We know that getting a safe and effective vaccine here is really the light at the end of this tunnel. So the planning that we're doing right now is very important, and we are excited to be moving towards this phase. So I'm going to just share a few updates on what we know on the vaccines coming and the plans that we're putting in place. You've heard a lot in the news about 2 vaccine candidates in particular recently that have released their phase 3 trial data, which is the last phase required for vaccine products. And the next slide, if you advance, is the two vaccines are, one of them is Pfizer, and the other one is called Moderna. And both of these vaccines are a 2-dose series. One is a 21 days and one's going to be 28 days. Both of these vaccines need to be maintained at frozen temperatures. And you've heard a lot of discussion about probably the Pfizer vaccine actually requires what's called an ultra cold temperature. So again, something that we're planning for so that we can accommodate those storage needs. So the really exciting news is that both of these 2 vaccines have been shown to be extremely effective. So Pfizer actually updated their data just today at about 95% effective. And that is really exciting. When we think about the different types of vaccines that we have out there that we get every day, some of our most effective vaccines are right at this level. So if, for example, our measles, mumps, rubella vaccine, or the MMR, most people, when they get that shot, have over 90% protection for life. And because of the vaccination rates that we have in our community, we've been able to stop measles outbreaks in their tracks. And so what's really exciting is when you have a vaccine that is this effective, it's going to allow us to achieve herd immunity a lot faster and potentially a lot longer than a vaccine that's not as effective. And it's really kind of interesting too. These 2 vaccines are both utilizing a technology that's called, it's RNA-based, messenger RNA-based. And so it's a little bit different technology where they're able to introduce a little bit of the RNA so that your body responds and starts to create the antibodies. And because of that technology, the side effects have been minimal to none, which again is really, really important. Safety data, side effects are really important. So both of these 2 vaccines have funding through Operation Warp Speed, which you've probably heard about. This was a federal program to help support vaccine development. And with Operation Warp Speed, the US government has already secured and paid for 100 million doses of both of these. So we know that we kind of have a pipeline coming once these have been reviewed by the FDA, by CDC, and we have all the recommendations that we really have. We are very fortunate here in the United States that both of these companies have a very strong presence here, both their research development and distribution. So all of that is really should be giving us all a lot of hope, basically. Next slide. I do not have a crystal ball, so I'm just sharing what may be the timeline here, but this is changing all the time. However, the best that we know at this time is that we've been planning for vaccine distribution, actually going even further before September. I was back in July starting our planning, but really planning ramped up heavily in September, October. We are anticipating that FDA is going to issue what's called an EUA. So that's an emergency use authorization. And that is the first step that the vaccines will have to apply for to be used here in the US. And FDA has said that they will basically immediately review the safety data and it will be made public so that everybody will be able to see that, review it. We anticipate that will happen likely for Moderna and Pfizer potentially here in the next month. Once that happens, it's got to go through CDC approvals and allocation distribution. And we anticipate being able to start vaccinating people for sure the beginning of the year and potentially by the end of December. And those will be, I'll show you a slide in a moment. We kind of have some triaging of how to hit the highest risk groups first and then slowly roll it out. So we kind of call phase 1 is like our really high risk groups. And then phase 2 is we can really get it out more and more broadly into the public. So my hope is that we are looking at that by next summer, we will have vaccine available, ready to anybody who needs it in the community. And next slide. So we don't have the final list of this process of which groups are going to be in like phase 1, phase 2, but there have been quite a few discussions. So we're planning for a number of these populations to make sure we're really ready to go on day 1 to get vaccine to these populations. So our healthcare workers are absolutely the top of very first group. We need to be vaccinating particularly our hospital nurses, our hospital physicians. that are caring for COVID patients and in our hospitals. That's critical workforce. We are looking at staffing shortages right there currently that are very serious. And the other group of healthcare workers that are also right away very important are our long-term care staff. So even before our residents, we need to get those staff vaccinated so that we have enough staffing capacity in our long-term care residents, as well as we start to create that bubble of protection. Once we hit those key healthcare groups, it's going to roll over then to some other high-risk groups, as well as some of our, what we call mission critical and emergency preparedness planning. So that includes some of our city partners, so our local police, our local fire, emergency medical, paramedics, some of our critical infrastructure staff at the county, as well as with our city partners. And then really a focus on high-risk groups, so 65 plus, people with significant underlying conditions, and long-term care. So we're in public health, we are working on plans for getting vaccine out to these different groups as fast as we can. Some of it's in partnership with other partners in the community that we're already working on, other folks that are able to help. And then a lot of it is us working with our Medical Reserve Corps and other groups and agencies that can help us ramp up the staffing we need to run clinics ourselves. By the time we get to phase 2, we are going to be working more on getting vaccine out to the public. And we're going to be running some larger clinics at that time, kind of similar to H1N1 if you were involved in any of those or went to those clinics. But we're also going to be doing some targeted outreach to make sure we're reaching some of our populations that might have mobility or access issues. We have a mobile clinic unit that we really want to make sure we're getting out to people that need it. And then finally, phase 3 is when we're, like I said, in July, a vaccine is widely available. You can get it when you need it. So next slide. So I'm going to stop here. I know there's a lot of questions that have come through, and I'm really excited to answer questions you might have. These are actually 2 pictures of some of my staff doing some drive-through clinics. So our disease prevention and control nurses, they've been doing vaccine clinics throughout the pandemic, and so we've really learned a lot about how to run clinics safely and during COVID. It involves different methods and techniques like drive-through and social distancing and things like that. But we are prepared and ready to go. We have a really, really dedicated staff who are really working hard to make sure we can get vaccine out as quickly as possible. And so with that, I will turn it over to Commissioner Atkins to help facilitate some of the questions here come in.
Thank you so much, Christine. Great overview, and we appreciate you pointing out our public health nurses, our public health team has done a phenomenal job. There's never been a better time for Dakota County to have had, just last year we were recognized as having the top public health, local public health department in the country. And if there was ever a time to have a group like you guys doing what you do, it's certainly right now. With that, I'm going to turn it over to Commissioner Slavic. We've also had, in addition to the vaccine side, the treatment side, the health side, there's been a considerable impact on our local communities, our local businesses. And Mike, you're going to kind of walk through some of the efforts Dakota County has made in addressing some of those needs. Then we're going to open it up for questions. So Mike, I'm going to turn it to you.
Well, great. Thank you. And, we'd just like to say, we certainly recognize that there have been very many people since the beginning of this pandemic that have been struggling, that have been hurting. Back in March of this year, the federal government, Congress had gone and passed the CARES Act for COVID-19 response, which was the Coronavirus Aid, Relief, and Economic Security Act. And with that, that money was then transferred to the state, which transferred to the local governments, our cities and counties within Dakota County. We were able to receive $52 million to be able to go in and help respond to much of the challenges that our citizens, our business, generally been really struggling with. So just wanted to walk through a little bit of some of the things that we used that $52 million for. And those pictures that you saw with Christine, that one of the very first things we had was the community clinics, and that's kind of a list of some of those things there. So we were able to do a couple interesting things. In addition to the community clinics that we had at the Northern Service Center, as well as over in Burnsville, we also were the first county in Minnesota that went and did a started testing our long-term care facilities prior to the state getting involved in doing much of that. Our assisted living, our group homes, we were realizing that ultimately the state took over part of that, but we realized that that was an area where we needed to make sure that not only the residents but the employees were free from COVID, and that we were not continuing to spread within those facilities. The other thing is Dakota County, of any of these suburban counties, we went and realized that our small businesses were really struggling. So with that, we've given out almost $14 million that has gone out to small businesses to help support and kind of keep their lights on, because we know it's not over yet, but it's been very hard for our business owners, and that in addition to some of the stuff that the state's been able to do, we've provided economic assistance, some housing assistance, to some eviction prevention. So there's been a number of things that we've done just to support those who have struggled the greatest within this pandemic. The other part in there is that our nonprofits, which when people aren't working and they're not able to make the businesses can't continue supporting at that level, we were able to support the nonprofit community, particularly those serving in the human services side and social services side of things. Something that we are quite proud of on the county board is we realized more than anything else that when everyone was staying at home in March and April, that having good internet service was crucial and very important with that. It's how you were able to do your medicine, your school for your kids. It's how you actually socially were able to interact. And one of the things that we are well aware of in Dakota County is we have some significant pockets that do not have very good broadband accessibility with that. So we've been able to go in, and we were able to put in some dollars to improve areas that are unserved or underserved within the county. And then the aspect in there that this was able to provide for the county services that we have. Some of the things that we had to continue to do, even when our doors were locked, we were still providing appointment services, and the government and the county did not stop even when all of that happened. So I think that it's just an example of a good partnership with the federal level, our state legislators. We worked very much in partnership with our cities and our townships. So this was just a way that we knew we were in crisis, and we knew we needed to help people, businesses, and nonprofits. And this was just an example of what we've been able to do as some of that. And with that, I'm going to pass it back to Joe.
Thanks so much, Mike. Yeah, if there was ever a year where it paid off to be debt-free, we're one of the few in the nation, few counties in the nation that doesn't have any debt. It put us in a position where we were able to do property tax, hold the line on property taxes this year. Just allows you to weather storms much better than most who are not in that position. With that, we've got questions pouring in. Before I start taking some of them and directing them to Christine and Mike, for anybody that's got a question, all you have to do is go to the bottom of your screen. You'll see a chat box. If you click on that, a box will pop up, and you can just share your questions, and we'll then direct them either to Christine, to Mike, or myself, and we'll address just as many questions as we possibly can this evening. Again, thank you all for joining us. Let's, Christine, the first question is going to you, and that is, it references from Lynn. It references that there's third vaccine. Are there other vaccines in development right now? And what have you heard about the timeline that they're on?
Yes, absolutely. There's a number of vaccine candidates that are also even in that last phase 3 trials right now. And so these are not going to be the only 2 COVID vaccines that we have. They just happen to be kind of the ones right out front right now. But there's several other ones that are undergoing tests here in the US right now with tens of thousands of people in them. So one of the ones that's been in the news quite a bit has been AstraZeneca, if you've heard that one. That's kind of been developed out of the UK, and they have quite a presence here in the US with their trials as well. And then Johnson & Johnson is another company here that has a vaccine that's in a phase 3 trial. And there's a number of vaccines all across the world in different countries that are in human trials, in phase 3 trials. I can't remember the exact number, but it's in the hundreds of vaccines that are in human trials. So it's really about getting to that last phase 3, because then you've had enough data to show efficacy and safety. So yes, there are other vaccines that are going to be coming and available.
And John, earlier to me, sent an email that kind of dovetails on this one. There's apparently the 2 vaccines that are available now, or that are about to be available, from Moderna and Pfizer, need to be stored at ultra low or really cold temperatures. Are some of the vaccines that are in the works, this is John's question, is will some be available at room temperatures and without multiple doses and things like that? Are those in the works as well?
Yeah, and so the cold kind of, we call it like the cold chain, because really vaccines can be stored and normally at multiple temperatures for set amounts of time. So for example, even Pfizer's ultra cold vaccine can be stored at probably a refrigerated temperature, we've been hearing, for like 5 days. So each of these vaccines, even though they are having to be stored long term, either ultra cold or frozen, most of them will have the capacity to be stored at a refrigerated temperature for an amount of time that will allow us to get it out, to the public. The other thing I just want to mention is that most clinics, as well as most public health departments, we have vaccine storage capabilities for both refrigerated and frozen vaccines already, and ultra cold units are being acquired as they're available. But most of us are ready to go, and we have portable coolers as well that maintain temperatures for a long period of time. So the really good news is that even though there are logistical complications, particularly with the ultra cold, it's going to be able to roll out utilizing some of these other tools and timeframes that we can use.
Got the question, I missed the name now. I think it was from Rita. Rita asked, how long will the vaccination last? Do we know that yet?
That's a really good question. I mean, we don't have the full answer to that yet. The first trials for Moderna's vaccine started last March. So we do have candidates, volunteers who got that vaccine all the way back in March, and they're still showing immunity. We don't know how long, though. Will we need to have a booster dose again later? That's possible. There's a lot of vaccines where we do a booster dose, like tetanus, we do one every 10 years. And so we don't know for sure how long, but we are seeing a good effect with these 2 in particular, as far as length being substantial enough that it's going to give us, again, that chance to hit herd immunity. So yeah, we don't know the full answer, but it's something we'll need to keep watching.
Another question on the kind of a similar one is the COVID antibodies and how long so there's people that have had COVID. And the question is, how long will they be able to go without acquiring it a second time?
Yeah, that's a great question.
And if you know that one, you'll win a Nobel Prize, I think.
I know.
So.
Yeah, no, that's a great question. It's something, boy, we keep just looking for an answer on. So from what I've seen, there's a number of different reports that have come out in peer-reviewed journals that we've been watching, and there really has been a range as far as how long people's antibodies are lasting and providing them protection. We've seen some folks who have gotten reinfected pretty quickly. We've seen other people who have significant antibodies up to 6 months out. So we know that there's a diverse amount of time that people who have already had COVID have protection. And part of that, if you think about it, is, each of our immune systems is unique. There are no 2 immune systems that are the same. And part of that is just from an evolutionary perspective, we've had to survive many pandemics like this, throughout human history. And so each of our immune systems activates a little differently. The good news I can tell you is that the vaccine-induced immunity so far has been stronger than the amount of antibodies we've seen in a natural disease. So what that likely means is that if you've already had COVID disease, it's very likely, we don't know for sure, but it's very likely that you're still going to be recommended to get the vaccine to give you an extra boost in your immunity.
And then Katrina, thanks. Some folks are messaging me directly. Some are sending them via chat to the whole group. whatever works for you works for me. But Katrina has this fairly specific one here about, would you recommend that those of us with asthma get the shots at all?
Right. So asthma, definitely is a condition that affects your lungs, and we know that COVID has really had some significant complications in people with lung disease. So yes, people with asthma will. I'm sure there'll be recommendations for specific underlying conditions. And it's also important to watch, like with the vaccine trials, they do. Enroll people with a variety of different conditions to test to make sure it's safe in different populations and different conditions. And so that's important, and it is part of the vaccine trial. So yeah, I think underlying conditions, especially ones that involve your lungs, watch for those recommendations. Very likely it will be including asthma.
And then Doug, Mike, I've got one coming for you next about how we can best help businesses and what the county's been doing. But Doug asks, could you ask the epidemiologist if the state publishes data about up-to-date turnaround time for getting results of COVID tests at different testing facilities? And then he wants to know, where would you go to get the quickest turnaround? Because everybody will rush there tomorrow, I'm sure.
Exactly. Yeah, no, I know it's been really frustrating for many people trying to get a test. The good news is we have a lot more options now than we did at the beginning of this pandemic, but it still can be really frustrating. Turnaround times do vary. There is no magic website that will tell you the exact turnaround times. I have heard anecdotally the saliva testing kits have a very quick turnaround time, and a lot of that's just because of the company that is running those. It's called Vault, that processes that, is located here in Minnesota. So the saliva tests, we're kind of lucky. People are getting those results normally, 48, 72 hours. PCRs, other ones, depends on kind of the laboratories they're sending them to. If it was me, I guess I would do the saliva testing kit because you can do it at home. It's very simple. You just spit in a tube and send it in. So that would probably be my go-to.
And for those that aren't familiar, how would you get a saliva test? If you want to do that home test, what's the simplest way to find the link for that?
Go to the Minnesota Department of Health's website. So they have in their COVID page a whole section on testing. You can click on it to order a saliva testing kit for home. And Dakota County is also participating in some really large upcoming testing opportunities here. And one's going to be at the Burnsville Mall. And the other one, I believe, is at the Armory. And that information is on our website. So there's some really big testing opportunities coming up over the next couple of weeks.
Okay. Thanks, Christine. Mike, I had a whole flurry and I think that the one I'm hearing most often here is about broadband. And I know where you are, broadband. I mean, where we all are, it is. But you just got appointed, I think, nationally to a group that's going to lead the way on trying to access broadband. Can you talk a little bit about that and talk about what the county's up to?
Sure. Well, thank you. Yes, we in fact had our very first meeting on Monday. I was appointed one of 36 county level individuals across the country from 21 different states to go and work on it. The National Association of Counties has formed this broadband committee to go and work with at the federal level. There's a lot of money that goes into improving internet access across this country, but how it's focused, where it goes, doesn't always make the most sense. Quite oftentimes it's whoever has the better lobbyist. And we're really trying to work as a National Association of Counties to really prioritize to be able to get the biggest bang for the buck. So we have everything from county commissioners to some IT people. And we started our very first meeting to have a conversation of where we were in our own individual counties and in our state. And we have some really good things happening in Dakota County as well. We have some areas that are pretty significantly behind compared to many of our peer counties in Minnesota, but we've formed the Dakota County Broadband Board, which is working with the major cities in the county to really kind of have all of our fiber that we have on an institutional level and have it all accounted for and being able to partner better with that. So our first step is kind of trying to learn what best practices we can learn from others, as well as there's a few really good ideas that came out of that I know we'll be bringing back to Dakota County. Also share some of our highlights and successes, and then finally really work on a better level with Congress. There are hundreds of billions of dollars every budget that go towards broadband, and you wouldn't know that just based on where it's going in that part. So that's one of the things is we're really trying to work with Congress to be a very strong legislative voice to be able to make sure that those are being used to the best of their ability.
Okay. Thanks, Mike. Another question, I'm going to put this one to you, libraries. This one came directly to me from John. John wants to know, are the libraries open? Can I get broadband at the libraries? Frankly, John's got a number of questions, but I know, Mike, you've been really pushing on our libraries to offer certain things. You want to talk about what our libraries are doing?
Well, thank you. And I'm one of only 2 county commissioners that has school-age children. So it's on the current board. So having the access to libraries has been very much one of my passions. And we've done a number of things in the libraries. First of all, we enhanced our Wi-Fi capabilities in the parking lots. So you don't have to go in if you're really struggling. It used to be you pretty much had to be in the building to use our county services and that. But we've amped that up. So one, you're able to go in and use our parking lots without having to have contact with others. Number 2, we in fact, just in the last month, we opened up Saturdays. So we are now open on our library system Monday through Saturday. We're still closed on Sundays, but our hours are getting there. Some of the hours are your 9 to 5, but we also have done some of the days where we open up at 11 and stay open till 7 o'clock at night. And then, as was said, we have a normal Saturday hours that we just started with that. And then the last exciting thing, which we use some CARES dollars for, is we went and purchased Chromebooks and hotspots that you can rent or check out with the library system to be able to use for if you don't have good internet or you don't have some of the devices that are necessary to function in some of the things with telemedicine and education. We've now purchased a number of them that are available for checkout at the library system.
Very good. Thanks so much, Mike. We, by the way, we should give a shout out. I think Representative Hewitt and Representative-elect Ryer are on the call with us today. Those CARES dollars, we owe a huge debt to our federal and state legislators. Dakota County, frankly, was not slated for that much help from those dollars until some of our folks really went to bat for us and more than doubled the amount of funding that much of it was frankly heading towards big cities. Minneapolis and St. Paul got a ton of money to be right out of the gate. We really had to scramble for and scrap for ours, and it's gone a long ways towards expanding broadband access, libraries, testing, long-term care facilities. Lots of good stuff have been utilized. But a shout out to those folks that have joined us. Also, I note folks, school board members, folks like Craig Angerson are online. We've got others. Our schools, like our cities and county, are all struggling with these issues. In fact, one of the questions, Christine, was for you, and that was, when do teachers, where do they fall in the line of, are they on the very front line? Are they further back? When would they get the vaccine when it becomes available?
Right. Teachers, and I would also put that in that group too, kind of our childcare providers, because they still are very much, again, on the front line, and their role as essential workers and keeping our hospital staff, for example, who need childcare and things like that is critical. So I don't know the exact point at which it will be, but what I've seen is it kind of will be in what we call 1B. So we know 1A are those highest risk kind of groups, but we also know that schools, childcare centers, and some of our other real congregate living groups that's going to be kind of that next group. So probably be more like phase B. And we're hoping, like I said, we're hoping vaccine will roll out January, February, March for that entire kind of phase 1, phase B. That's really what we're hoping.
Thanks, Christine. This is a hard one. And I don't know, it's from Fall D. The trials so far show the vaccines are about 95% effective. Does that same percentage apply to the vulnerable? Will congregate care facilities see a 95% reduction in deaths with this vaccine? What a phenomenal question, because that's been Dakota County's experience, and I think all across the state and across the country is our most vulnerable are most likely to have a bad outcome from COVID. Christine, do we know?
Yeah, absolutely. I agree. This question is critical. And we don't know the exact percentage of reduction, but what we do know is if the vaccine is 95% effective, which we've looking at it, it is, and if enough of the healthcare worker staff there get it and the residents get it, you can really create that web of protection. So when we talk about herd immunity, that's what you're doing. You're creating this web of protection, and that's what we're going to see happen in our long-term care. Doesn't mean we're going to have zero cases or zero deaths. Unfortunately, that's probably not true that it's going to be zero, but we know it's going to be significant. And as far as effectiveness, they did run the Moderna's and Pfizer's have included 65 plus in their vaccine trials, but it's something we need to watch because, as we know, sometimes the elderly don't respond as well to vaccines because their immune systems are a little bit weaker in general. As we get older, they're not quite as robust. But what we've seen so far is that they are effective in the older populations. So at this point, we're hoping that this is the case. The exact percentage we don't know, but it is definitely going to help reduce that severity in our long-term care.
Christine, thanks. And a great question. Lots of good questions coming in. Mike, this is a good one. John, actually, Representative Hewitt, good question. As individuals are behind in their utility payments, are there any programs out there for them or with utility companies?
Well, the answer is yes. Right now through December 31st, just had to do a quick check on that, but the state has a program that covers utility bills using CARES dollars through December 31st. And I'm looking at that, and I believe there is something related to that may be extended using some state dollars to do some of that. We are currently under the cold weather rule, so your utilities can't be shut off between October 15th and April 15th. So they can't be shut off regardless, but that doesn't mean you don't have to pay it back at some point. But there is actually assistance at the state level currently through the end of the year. And just to make note that the county also provided utility and rent assistance on its program, but that deadline has expired.
Okay, thanks, Mike. By the way, we got a question about these slides being available. We will post them the same page that you accessed to come to this meeting. We'll make sure that we've got the slides available for you on that page that we posted tomorrow. Great point. And great, by the way, to our team that put this together. Nathan, Mary Beth, Scott, Christine, and your team. You guys, this has been fabulous. The work that went into prepping for this. I see we've had nearly 100 people that have joined us over the course of the evening. So your work is very much appreciated. Question for Christine from Derek, and Derek asks, I have families ask about viewings and visitations if their loved one has died from COVID-19. Can you please clarify us if COVID-19 can still survive for any period of time after the death has occurred?
Yeah, so that's a really difficult situation. My heart goes out to families, in this situation. In general, with funerals and visitations, more so the risk we think about with public health is between the people that are there together to celebrate the life of their loved one that they've lost. So that tends to be actually more of the risk when it comes to funerals and celebrations of life visitations is actually the transmission between people coming together. As far as when a person dies of COVID, we do know that the virus lives for a period of time, but it normally doesn't last. What we've seen on different, the estimate is about 72 hours is that it lasts. And I don't know if that's been tested in that specific situation in people that have died or not. I haven't seen any specific data on that, more so just generally looking at testing of how long the virus survives on different types of surfaces, substances. So yeah, difficult question, but that's kind of what we know at this point.
Eric, thanks, by the way, for what you do at Summit. I know it's always hard when people are grieving, but I got to imagine it's particularly challenging for you and folks in your line of work right now. I'm going to come back to Judy. I jumped ahead. I'm sorry, Judy, for missing your question. How would a person sign up for a vaccine when it's available? Christine, is there a sign up yet, or is that going to be coming, or how's that going to work?
Right, not yet. What's going to happen is providers right now are registering with Minnesota Department of Health if they think they're going to be able to get COVID vaccine out to the public. And depending on in our county, how many different clinics there are that are able to do that, you're going to be able to have some options. So, for example, in public health, like I said, we're going to kind of focus on that 1A, 1B, and then we're going to open up some larger clinics. And so for us, that information on how to register for those clinics will become available to you. We'll put it on our website. So that will be an option for many people. But there will also be options. Some of our pharmacies, some of our clinics, they're also going to be able to have a COVID vaccination appointment. So really, you're going to have a couple of different options. And as we see it become available, that information will be posted both at the state level and then here at the local level.
Thanks so much. On that note, and I missed Melissa's question earlier, but it goes to this: will volunteers be needed with distribution? Dakota County has, I gotta believe it's one of the best volunteer programs in Minnesota. We've literally, I think, Mike, is it $1 million a year in yeah, I see it, over $1 million a year in volunteer contributions by folks who volunteer their services to help out with county efforts. So is that something that that the public health team is looking or expecting to need, is help by volunteers?
Yes, absolutely. Volunteers are going to be critical. If you have not already and you're interested in volunteering, please go to our county website and click on volunteer. If you register to become a volunteer with our county, one of the questions you'll get asked is if you'd like to join the Medical Reserve Corps. So the Medical Reserve Corps is who public health works directly with to staff at our clinics. And yes, we do need volunteers. Particularly, we're going to need volunteer nurses, other folks that are comfortable giving vaccines, but we also need people who are going to be comfortable helping people register and know where to go and fill out forms. So all kinds of skill sets can be used. Please sign up. We're going to need help. So yes, thank you.
Yeah, thanks so much for the question, and thanks to our volunteers. I mean, it literally numbers in the hundreds of people every year who volunteer their time for us. Christine, this one comes from Jolene. If you have the option to be included in the phase 1 immunization, would you get it? Or would you rather wait for a later phase to see what some of the side effects are? And maybe you can, in the course of that answer, can you kind of talk about what some of the side effects are?
Yeah, this is a great question. And there's, a lot of questions around the vaccines. They are new. So for me, what I've been doing is the way I like to do is dig into the information, get every piece of information I can to educate myself. What do we know? So both Moderna and Pfizer's, as I mentioned, they all of the data from their vaccine trials is going to become public, and actually some of it is already. So Moderna's, if you're a public health nerd like myself, you can go read in New England Journal of Medicine right now their phase 1 data and trial. And so the side effects for both Moderna's and Pfizer's have been very minimal. And a lot of that's because it's this RNA-based technology versus some of our other vaccines that might be a live attenuated, there's kind of, so for me, yes, I would get it because I'm watching that data very carefully. That getting that information is important to make that informed decision. So I feel very comfortable with both of those vaccines. And also the fact that they have a strong presence in the United States. These are both companies here that we know they have to fall under all the regulations here in the United States and have been watched closely. So both of those give me a lot of confidence in their safety.
Just, Christine, one of the things I heard, and maybe I heard incorrectly, but just so folks have an expectation, is that one of the vaccines, I think it was the Pfizer one, actually kind of hurts, and you're sort of sore for a day afterwards. I'm just wondering, if you got to have 2 doses and the first one hurts, is that actually true? Number one, and how important is that second dose?
Yeah, I mean, unfortunately, both of these are going to be a shot. And, I look forward to the day when we can get vaccines in a way that doesn't hurt. Believe me, I have 3 kids and I wish for this all the time. Unfortunately, the technology just isn't there yet, besides a few exceptions like with flu mist through the nose. So yes, these are going to be a shot. Both of them are going to be muscle shots. Most of us will get them right in our arm. Similar, if you've had like a tetanus shot, it's probably going to be sore. A lot of vaccines do have some soreness at the site. So that is part of it. And most of the time that soreness doesn't last for very long. Some people maybe a little bit longer than others. A lot of us, 24 hours and it's gone. But yes, it is, there's some soreness at the site. There's things you can do. You could take over-the-counter medications, ibuprofen, Tylenol. You can do ice beforehand with kids. Sometimes that's very helpful. So if you are somebody who is, has a fear of needles or trouble with vaccines, ask your provider. There are some resources out there to help make that experience a little bit easier for folks that really struggle with it.
I find it works best if I just don't look. So try to look away. Same when I give blood is if I don't look when they put the needle in, everything goes just fine. So Claire asks, when people get vaccinated, will they receive any kind of card to indicate that they've had proof of vaccination?
Yeah, good question, Claire. We are working on that because yes, we know people are going to need that, and there's going to be a couple of tools. So yes, we're planning to give you some type of a certificate. Different clinics are going to do it differently. The other good thing is that our immunization data is also available in a immunization registry, so you can participate in that, and that way your vaccine data is saved there. But yes, the plan is to give you proof of it. And also just as a reminder, a lot of that's going to also have when you need to come back. So we're going to give you a sheet that says you got the shot, but also to say you need to come back at this time to get that second one, which is also really going to be important.
Christine, Nancy asks, why can't we get more numbers for our specific county about COVID? And her point is just having the number diagnosed and the number who died that day is not all that helpful. One day the state said there were about 7,500 diagnosed and 26 died, that this is only a 0.3% rate, which is almost none. And I quote that from Nancy. Can you talk to us about the numbers and how impactful those numbers ought to be to people?
Yeah, sure. Thanks for the question. Yeah, there's so many different metrics and numbers out there that people are looking at. I'm sure you probably, if you're looking at that level of statistics, been on our county website. We do have a really good interactive dashboard on Dakota County's website, and it's updated daily. And there's a lot of other data on there besides just that count, because that doesn't tell the whole story, right? And so some of the things that you'll find on there are more details about age groups affected, where we're seeing hotspots, ethnicity data. It's not really one thing that we should be looking at. It really is about the whole picture. So I encourage you to go there and drill down into some of the details. The other thing is that, of course, Minnesota Department of Health has data on their website that drills down a lot deeper than that. But some folks, if you really want more data, there's a weekly PDF report that MDH puts out that actually contains even more data, and it focuses a lot more on the positivity rates, because what we see with COVID is you got to look at a trend over time. One day's point of data really doesn't tell you a lot. You need to look at a trend. You need to look at positivity rates, not just a count. So that report gets into that level of detail. So if you want to go there, check out that PDF report. It has a lot more data. And then if there's something else specific you want, send an email, give us a call, see if we can help you out.
Christine, Lynn asks, can one of the participants, and this would be you, probably better so than me or Mike, address the difference between the various vaccines so I can make a decision on which one to try to get? And which one would you try to get? If you had your choice between the ones that are currently available, which would you make an effort to try to get?
Yeah, so that's a good question. And I actually look forward to the day when we have choices and options. Unfortunately, what's probably going to be the case for the first phase in particular is we're not going to have as much vaccine as we want initially.
Say, Christine, you muted, so you're going to have to.
Oh, goodness. I
I'm
made it
usually
this far.
I'm my most articulate when I'm muted. I always find, but
Thank you. Right. So Moderna and Pfizer's, we know that their technology is very similar. It's both messenger RNA. Their effectiveness or safety is very similar. So both of those, I'd say there's really, I don't see a reason to prefer one or the other. And then some of the other vaccines that are going to be coming out probably just a little bit later have some other technology. And so it'll be really interesting to see what type of safety data and efficacy data they have, because maybe they have some that will be particular population, that it's really successful in. So the good news is we have more options coming. We just don't really know entirely until we see that safety efficacy data. But yeah, right now, both Moderna's and Pfizer's really are very similar as far as things I would look at. So I would get either one.
And Mike, I'm going to go to you next. I've got one more for Christine on the accuracy of tests, whether it's saliva or the swab, and which one's more accurate. Mike, I'm going to come to you with some election questions that got sent to me about the accuracy of our elections, the increasing voter engagement, those sorts of things. But Christine, you want to take this one about swab test or saliva? Which one's more accurate?
Right. So both the swab test and the saliva test are using what's called PCR technology. So the actual technology is the same. The problem is more of a user error, right? So if you're doing a good job with following the directions and the specimens, the efficacy is going to be very similar because they're both, as I mentioned, using the same technology to measure for PCR. So from what I can see, they're really both very good. Both tests, I would recommend whichever one you can do, get your hands on is going to be a good test. Just user error, make sure you're following directions is the most important part.
Okay, thanks, Christine. Mike, I'm going to go to you. By the way, congratulations to Commissioner-elect Mary Hammond Rowland, who's on the call with us tonight. She's going to join us on the county board in January. But Mike, I got actually three different questions. One was were the polls safe? Was that a spreader event? What sort of efforts were made to prevent it from spreading? And then questions generally about voter fraud. Did we see any fraud? Did we see any tampering? Illegal votes, that kind of stuff. Can you address those?
Sure. Well, I think we also need to say congratulations to you as you won your reelection, your hard-fought reelection.
It was a nail biter this year.
Campaign as well. So certainly glad to have you back in January as well. So I think in terms of the safety at the polls, the first thing I think to make note of is that we had over 92% of all registered voters voted in this 2020 election, and over 51% voted before election day in an absentee version, whether that would be absentee in person or via mail. So we had a pretty good chunk of 51% of the overall registered voters did that. So we had a good chunk who had already taken care of it, which made the polls in many communities a lot lighter. So that did certainly help this, but also the election head judges and the city clerks, they worked just amazing to go in and make sure that there was all of the extra protocol there. And I voted in person on election day because for me, it's kind of like Christmas morning. And I like to make sure that I go on election day to do that. So I went, and I will tell you, the precautions that were taken in there were very well done. And also just to say that we have not seen any reports from public health that election day was a pinpoint of any COVID cases. So that's a kudos to everybody being responsible in Dakota County for that one.
Yeah.
I think on the second point in there, just the trust of elections and that, I think it's very hard to know what goes on. We have an amazing team that they typically do about 5 elections a year between your special elections and the primaries, and this year with the presidential preference election. So there is quite the big process on there. I will tell you that if you want to know the most accountable way to prevent the fraud, it's kind of counter to what most people would think. It's actually the absentee process. You go through that process, and your signatures have to match. You have to put down a social security number, a driver's license, those have to match between the application and the actual form. So there's a much more rigorous process in the app that as opposed to election day where you verify your address and you sign on a poll book. So if you want to know the way that you get extra steps in there, it's actually the 51% who voted prior to the election. That being said, there's quite extensive training that goes with that part in there. We've been able to have no reports. We did our canvassing on earlier last week, and we one of the things that has to happen with that is the members of the canvassing board have to randomly draw 5 precincts from across the county that will then go and be audited, where they'll make sure that the numbers match and the scanning of the ballot box actually make numbers as they were reported through that, and that came back accurate based on what was done on the hand count for that. So they go through that process. There was about 20 people who viewed that. So just to share that aspect in there, that was seen in there. And if I may, just one kind of answering a question that a lot of people asked me, and I know the answer to in terms of elections, and that is, you saw a lot of people saying that they used a Sharpie pen when they filled out their when they filled out their ballot on election day. And in 2015, we went and upgraded our ballot system in all of Dakota County, from the townships, the cities, large and small, and all the way throughout the county. And with that, we have we get a specific pen that it's a Papermate medium flare felt tip pen, which we buy, and that would be the same pen you would use no matter where you voted in Dakota County on election day. And so a lot of people are like, I think I used a Sharpie, and we can tell you that you did it. So you know that the reason why this pen is used is because it's a quick drying ink. So it looks like a Sharpie and all that, but it dries so it doesn't smudge and look like your vote was disqualified on there. So it is true that if you would have used a regular Sharpie, it would not have it would have bled through, and it would have actually marked potentially multiple places. But every single precinct within Dakota County uses the exact same pen. In fact, I was talking to the director of elections, and he said that they ended up buying something like 10,000 pens right away that they were able to go and use just to make sure, because you go through a lot of pens in 5 elections a year.
Oh, Mike, thank you so much. And by the way, thank you to everybody. I'm guessing 92% of the folks on this call tonight on this Zoom meeting were out there voting on election. Actually, I'm guessing that anybody who's on this meeting with us is definitely a voter. And it was great to see Dakota County leading the way with 92% of folks, regardless of who you voted for. It was just a great outpouring on election day. To see so many people getting out. Folks, we're going to have to get wrapped at this point, but we sure appreciate everybody joining us this evening. We wish you all the very best of health. If you have additional questions, you can find myself and Mike, I think Christine, we're all, just go to the Dakota County website, put in our name in the search bar, you'll find us. Our emails are on there, our phone numbers are on there. We're always happy to take your questions and your concerns, especially all the time, but especially right now with so much that's going on. Thank you so much to Nathan, Mary Beth, Scott, Christine, and Mike for taking so many questions this evening. To Town Square TV, Egan Television, I think Hastings is joining us. This has been just terrific having everybody with us this evening. With that, that's, by the way, thank you all for these nice comments that are starting to roll in. We very much appreciate you being here. We will have another one of these likely in a few weeks, hopefully taking on, there are more things going on at Dakota County than just COVID. We can chew gum and pat our heads and do various things all at the same time. There's lots of important stuff that's still underway at Dakota County. But we really wanted to focus on COVID, on vaccines, on the plans for distribution. We'll be back with more information in a few weeks or so. In the meantime, best wishes to everybody. Stay healthy. We'll talk to you again soon. Have a great evening. Take care.